Welcome back to the Caregiver Minute, where every weekday family and professional caregivers gather to refine their skills, gain inspiration, and prepare to serve. Well, I'm here again with our Chief Medical Officer, Randy Vawdrey. And yesterday, if you tuned in, we were talking about the brain-gut connection as opposed to the gut-brain connection. We wanted to talk to you a little bit more about gut health today because so many of the people that family and professional caregivers serve have major gut health problems. They have this seemingly losing battle between constipation and diarrhea, and they're on a lot of medications that affect gut health. I thought it would be valuable to bring Randy on here as a provider and talk a little bit about some of the medications you should be aware of that could have a significant impact on gut health and really kind of goof up the experiences that we're having with the people that we serve.
Yeah, this is a big component that I'm always considerate of when I'm going into an assisted living center or a skilled nursing home to work with individuals who have some form of dementia, and they almost always have polypharmacy. You've heard that term before, right? It means they take multiple medications, 5, 10, sometimes even more medications. And think of how much those medications impact their GI health or their bowel health. For example, narcotics are very constipating, and benzodiazepines make it so you don't move your bowels very well. Most of our patients are taking acid reflux medicines, right? They're acid reducers. And it's interesting, many of them take them because if they've been in the hospital gives medications that would upset the stomach. So the hospital is giving them an acid reducer so that when they take those medicines, it doesn't make them sick. But when they come out of the hospital, no one stops that medicine. We continue those medications. And when you take an acid reducer, it really dramatically impairs your GI health. You need stomach acid in order to turn on pancreatic enzymes, or you need stomach acid to break down proteins. You'll get really super bloaty if you're not breaking down those proteins. Another class of medication that has warning labels all over it from our FDA and the government agencies are medications called anticholinergic medications. You've probably heard of trazodone, or you may have heard of amitriptyline or Elavil. These are medications that were developed for depression and anxiety, but we don't use them very often exclusively for those treatments because they're so sedating. So it's very common to give those to elderly individuals so that they can sleep better at night. The problem is they have a warning and a risk. They're called anticholine or anticholinergic medication, and choline is the neurotransmitter of cognitive function. It makes us crisp, it makes us bright. And so if you're constantly blocking that, you slow individuals down. In fact, in closing, I want to mention that most of the medications for the treatment of dementia are designed to increase and raise the level of choline in the body and in the brain. So if you're giving a medication that blocks choline, it's a double whammy for that poor individual that you care about and you're trying to help. Other medications, just quickly, think of antihistamines, right? Benadryl, Zyrtec, Claritin, these antihistamines also block choline. So we have to be very thoughtful about the GI health and the gut-brain, brain-gut connection in the context of the medications that a person is taking.
So some of the people that you're serving might be taking a drug like donepezil. You know it as Aricept. Aricept is designed to try to help people have more acetylcholine, which is that neurotransmitter Randy was talking about. Choline's the building block of that. And if you're taking something like Benadryl that's anticholinergic at the same time that you're taking Aricept, you're playing a tug-of-war. Now, to be clear, we're not encouraging anybody to discontinue medication for someone they're serving. Maybe you're taking care of a family member in the home. Don't just stop medication because you heard it here. This warrants a thoughtful conversation with the person's provider. Maybe if they're on Benadryl because they've got terrible allergies, you can consider other options. Maybe you could have a discussion with the person's physician. But we wanted to provide some good information so that you can be thinking about things that can affect gut health. We hope that's helpful to you and to the people that you serve, and we'll see you again soon for another episode of the Caregiver Minute.